Welcome to the image analysis on AP axial projection on toes. Image analysis guidelines on the AP axial projection of toes state that the mid-shaft concavity and soft tissue widths are equal on both sides of the phalanges. The interphalangeal joints and the metatarsal phalangeal joint should be demonstrated as open. The phalanges are seen without foreshortening. No soft tissue or bony overlap with the adjacent digits is present. For a single toe projection, the interphalangeal joint for the first toe and the PIP joint for the second to fifth toes is at the center of the exposure field. For an AP projection of all the toes, the third MTP joint should be demonstrated at the center of the exposure field. Phalanges in half of the metatarsals are included within the exposure field. I have included the image analysis guidelines. So let's talk about toe rotation. When we have lateral toe rotation, when the foot is turned on its lateral side, you will start to see that the soft tissue of the phalange is greater on the medial side of the toe, as you can see here. Now we have just the opposite on a toe AP axial projection with the toe rotated towards the medial side. You will start to see mid-shaft concavity greater on that lateral side, as you can see here. And you will see that you'll have more soft tissue on that lateral side. For this AP axial projection, I wanted to demonstrate what an AP axial projection looks like without a central ray angle of 10 to 15 degrees. You can see that the distal phalanx is foreshortened and your joint spaces are closed. So that's why we put on that axial angle, central ray of 10 to 15 degrees to obtain those open joint spaces. Some institutions may not require this angle, so you will have to refer to your protocol to determine the right projection that should be taken. So let's take a look at our first practice analysis. The first thing you should look for an AP axial toe, this is the soft tissue symmetrical on both sides of the toe. And it is not. You can see that there's greater soft tissue on this medial surface. You can also see the concavity on that medial surface there. So the toe was rotated laterally. In order to correct this image this projection, we need to rotate the foot medially until the foot and the toe is flat against the IR to obtain the projection that we require. In our next AP axial toe analysis, again, we want to look at the soft tissue and its symmetry. You can see that there is greater soft tissue width here on this lateral side, and there's mid-shaft concavity over here. So this should indicate to you that the foot and toe was rotated medially. In order to correct this image, we need, or create our next repeat, we need to laterally rotate that foot until the foot and the toe is flat against the IR. In our last AP axial toe practice analysis, Again, we're going to look at the symmetry of the soft tissue. And in this projection, we do have soft tissue overlap onto the second digit. Also, we should be asking ourselves, is our interphalangeal joints open? And if they are not, then we may have a central ray angulation problem. I'm also looking at the soft tissue, and I do feel like there's a little bit of concavity on this lateral side. So we may have a little rotation here. In order to correct this projection, we need to angle our central ray to that 10 to 15 degrees. Try to separate the distal phalanxes, and also make sure that foot is flat against the IR to free it up of superimposition and of any rotation. Let's move on to our AP oblique projection of the toes. Image analysis guidelines for the AP oblique projection state that there should be twice as much soft tissue width and more phalangeal concavity present on the side of the digit rotated away from the IR. Interphalangeal and metatarsal phalangeal joint spaces should be demonstrated as open. The phalanges are to be demonstrated without foreshortening, no soft tissue or bony overlap from adjacent digits. For a single toe, the interphalangeal joint for the first toe and the PIP joint for the second to fifth toes is at the center of the exposure field. For taking a projection with all the toes, the third metatarsal phalangeal joint is at the center of the exposure field, and phalanges and half of the metatarsals are to be included within the exposure field. I have also included the image analysis guidelines for your review. Let's take a look at insufficient and excessive toe obliquity. In insufficient toe obliquity, we will see that the soft tissue width and the proximal phalanx are going to be closer to equal on both sides of the digit, okay? And when you see that, it's going to look like an AP projection rather than an oblique projection. You're insufficiently rotated. So you will have to increase rotation in order to obtain the image. And in excessive obliquity, you're going to see that there's more than that twice the width of soft tissue present on one side. And you can see right here, there's a lot. We're almost lateral. I think we're over-rotated. We went from lateral to excessively oblique. And also, you will see that the proximal phalanx midshafts are demonstrated with more concavity than the anterior aspect of it. You start to see that the toes start to superimpose as well, and we want to free that up. We want an oblique, so you are going to have to bring that foot back down to that 45 degree oblique. So let's take a look at our practice analysis here. The first thing I'm going to look at for this oblique projection is the midshaft concavity, and on each side, are they close to being equal? And also just the soft tissue width. If you can recall, we want the soft tissue width for an oblique projection to be twice as much as the soft tissue width, and more phalangeal concavity should be present on the side the digit is rotated away from. And so we should be seeing that on this side, and we are not. So what we are going to need to do is increase the toe rotation or foot obliquity until the affected toe is at that 45-degree angle with the IR. And so we would need to increase internal rotation here. Moving on to our lateral projection. Image analysis guidelines for the lateral projection state that the condyles of the proximal phalanx are to be superimposed. There should be no soft tissue or bony overlap from adjacent toes. The interphalangeal joint for the first toe and the proximal interphalangeal joint for the second to fifth toes is at the center of the exposure field. The phalanges and metatarsal phalangeal joint spaces are to be included within the exposure field. We should know that the first toe projection should be internally rotated, and whereas how we can see for like the fifth toe and the fourth toe, you may have to should laterally rotate the foot in order to get the anatomic body closer to the IR. I have included the image analysis guidelines with this presentation for the lateral projection. So let's look at insufficient toe rotation. An insufficient toe rotation for the lateral toe projection, you will start to see that the condyles here are not superimposed, okay? And that is the first thing you should be looking for. The second thing you should be looking for is the rest of the body superimposed as well. That will give you an indication that you're not rotated appropriately. We should be seeing this distal phalanx on end, and we're not. And so another key indicator to understand if we're insufficiently rotated is when the metatarsal heads here are demonstrated posterior to this first toe, okay, and which they are. This is a left foot, you're turning it in medially, so therefore these toes or metatarsal heads are posterior, okay. That is when you should be able to how you should be able to identify that we are insufficiently rotated. Now, in excessive toe rotation, what will happen is you will see that the metatarsal heads here will be positioned anterior to the first digit. So that should be your key indication to excessive rotation, and we need to decrease that rotation in this projection. In this first image analysis, the main anatomic misalignment is that there is a lot of soft tissue overlap here. So this is a demonstration where you may have to use tape or some type of immobilization device to remove those toes from overlap. In this second image analysis, we can see that the condyles here of the toe are not superimposed, okay, and that these metatarsal heads are anterior to our first digit, so we're excessively rotated. We need to decrease rotation. In our third image analysis, we can see again our condyles are not superimposed over here, and these toes are demonstrated posterior to the first digit, so we need to increase rotation in order to correct this image. This concludes the image analysis. If there are any questions or concerns, please feel free to reach out.